Welcome to the media briefing today. The doctors we have today are Dr. Albert Au, Principal Medical and Health Officer of the CHP, and Dr. Larry Lee, Chief Manager of the Hospital Authority. Dr. Au will tell us about the new cases. Good afternoon, members of the public and media friends. Now, I will report to you the latest information gathered yesterday on the 24th of March. Yesterday, through PCR tests, we have found 4,537 cases, 71548. That's the case number. They include 580 cases confirmed under the Hospital Authority and 376 cases confirmed under the Public Services Laboratory. The remaining 3,222 PCR positive cases were confirmed by private laboratories. On RAT, yesterday we had 5,827 RAT confirmed cases. Overall, yesterday we had confirmed 10,405 cases. So far, in the fifth wave, we have had 109,898 cases, including 396, 167 cases confirmed through RAT. Among the cases confirmed yesterday, 4 were imported. The remaining cases were all infected locally. In terms of genome sequencing, we have performed genome sequencing for 1,342 cases. We have found no cases with the L452R strains. Another some 1,000 cases are confirmed negative for the strain, that is Omicron, and the remaining 22 samples were unidentifiable. Yesterday, we had one new elderly care home with reported cases involving 6 residents. Yesterday, there were no residential care home for persons with disabilities with new cases. So far, in the fifth wave, there were 783 elderly care homes with outbreaks. Among them, 52 care homes have seen outbreak in the past 2 weeks, accounting for 6.5% of the total number of care homes in Hong Kong. It involved 972 residents and 267 staff members. So far, 248 residential care homes for persons with disabilities with outbreak. Among them, 31 had outbreaks in the past 2 weeks, accounting for 9.3% of the total number. The 31 care homes involved 553 residents and 233 staff members. So far in the fifth wave, deaths involving residents in care homes there were 3,685 cases. Now, the overall fatal cases number, so far we have recorded 6,749 deaths in the fifth wave. Compared with yesterday, there are an additional 192 death cases. The fatality rate is 0.61%. The disease patients' age range from 11 months old to 112 years old. The median age is 86. For children, we have 7 deaths. For adults between 18 and 59, there were 264, accounting for 3.9% of the total deaths. The remaining 6,649 cases involved elderly people aged 60 or above, accounting for 95.9% of the total. Among them, 4,787 cases involved elderly people above 85, accounting for 70.9%. In terms of vaccination status, the latest number shows that 87% of the diseased patients have received no vaccination or just one dose. Among those above age 85, more than 80% or more than 90% only receive a 1 dose or no dose. Among all the deaths, for those who have received no vaccination or just 1 dose, the fatality rate was 1.79%. For those who have received 2 doses or above, the death rate is only 0.11%, a difference of 16 times. For those above age 80, those who received no dose or 1 dose, the fatality rate is 11.1%. For those who have received 2 doses or above, the death rate is 3.36%, a difference of 3.5 times. Now, Dr. Lee will tell us about the hospital authority situation. Now, we have 10,654 patients receiving treatments in our hospitals, including North Lantau Infection Control Center, the AWE, and other facilities. Yesterday, we reported 35 critical patients. The 35 patients, among them, 20 were not vaccinated. 48 are serious, and 105 patients are critical in ICU. As at 0 hours today, in the past 24 hours, 162 patients who had tested positive passed away, including 85 males and 77 females. Among them, 86 were from care homes, 97 were without vaccination records, 45 had 1 dose, 19 had 2 doses, and 1 had 3 doses. The majority of them, 195 of them were, 156 of them were 65 or above. Now, I would like to highlight 4 patients who were younger. 21-year-old male with no vaccination record with chronic disease. He was bedridden. He resided in Siu Lam Hospital with edema. He tested positive on the 2nd of March, and he was transferred to the Tuen Mun Hospital. He had a shortness of breath and required oxygen support. His situation deteriorated until and passed away at 2 a.m. on the 24th. The second patient was a 50-year-old female with 2 doses with chronic disease. She had received organ transplant with leukemia and other types of cancer. On the 19th, she went to the A&ED of Princess Margaret Hospital. On the 17th, she was tested positive with shortness of breath and fever and cough. In hospital, her oxygen level dropped and required high-level oxygen support. We prescribed steroid antibiotics and remdesivir for her. However, she passed away at 1:30 a.m. on the 20th later. And then a 50-year-old male with no vaccination record with chronic disease, a care home resident, as well as a patient in Kwai Chung Hospital with epilepsy and stroke. He contracted the illness on the 14th of March and was transferred to the Princess Margaret Hospital A&ED.
His oxygen saturation was low and needed oxygen. He had a fever for 3 days, and X-ray indicated that he had pneumonia and was admitted to Princess Margaret, and his condition deteriorated, and at 2:30 a.m. on the 24th, he deceased. The fourth person was a 58-year-old male, and he was immobile and needed to stay at home. He had 1 vaccination, and on the 24th of March, he discovered that there was more shortness of breath, and he lost consciousness and was sent to accident and emergency. And at the time, his RAT was positive, and in the emergency ward, he was attended to and then discovered dead. And in this case, we had to refer to the coroners for investigation. So there were some figures that are lagged. There were 30 people who deceased between 23rd and 24th, 18 male and 12 female, ranging from 59 to 100 years old. And the last day, we had 1,934 who were recovered, and 28 who were discovered to be positive, and 30 plus patients are in close contact. And right now we have 20,535 confirmed positive, and 26,000 workers who have returned to the workplace. Now, regarding TCM, we have some information to provide. That is, starting from April last year, the TCM office clinics have been providing TCM service for recovered patients. So when the patient, within 6 months of discharge, they can receive 10 consultations at TCM for free. So from April last year, we had served more than 5,500 patients, and we've had some 15,000 visits. So in light of the fifth wave, there are a lot of patients who don't need to go to hospital, so we don't have any discharge records. So recently we have updated the program. So even if they have not been admitted to hospital, as long as they can provide formal records such as Department of Health or confirmation records, isolation records, they can receive 10 free TCM visits. But if patients only provide RAT pictures and if they have no ID, then we cannot confirm that, and it would be difficult to provide these free services. So to receive a free TCM service, we will only accept cases very carefully, and we hope that the public understand. We will continue to strengthen TCM services, and we will try to streamline the arrangements, and we hope to provide clear information to patients. So under the fifth wave, we have a lot of increased demand for the clinics. We have more than 500 new cases per day. We will adjust our capacity, and that would conclude my report. When you raise questions, please indicate your media outlet. I have the following questions. Yesterday, in the RAT web platform, there was a false case, and the police are investigating it. So when we have false reports, will the government increase testing? Will the government discover more false reports to prevent abuse? And this morning, the CE also said that the calculation of death cases, we need more analysis. The majority of cases might not be related to COVID. If that's the case, the actual number of deaths related to COVID might come down. So what is the actual number of deaths that is actually related to COVID, and what is the percentage? At the same time, Hong Kong U Internal Medicine, Dr. Hong Fang said in a radio show that if the number of cases decreases, then in June, for outdoor activities, we might not require people to wear masks. So have you assessed that? Can that really be implemented? The CE also said that private doctors could prescribe the oral medication. So how much oral medication will you reserve for private doctors? Thank you for the questions. First question was about our RAT positive web declaration platform. Now, the platform has received some 400,000 cases, and we have also confirmed the cases. So it indicates that the platform is effective in monitoring the epidemic. We understand that every day a lot of the public rely on RAT to discover whether they are positive. So I urge the public, if you discover you're positive, you need to report as soon as possible. When we can confirm the case, every day for the confirmed cases, we will conduct a percentage of sampling and arrange these people to receive a PCR test. Now, if the PCR test is negative, then we will conduct investigation, including contacting the patient. We will check the photograph to see whether it was a mistake, and we will arrange for a PCR test. If the test is negative, we will see how they conducted the test, which brand of testing product they used, and how they took the sample. We will arrange for these RAT positive cases, and if they subsequently test negative for PCR, they will be quarantined and they will be sent to Penny's Bay for further testing. During investigation, we will try to discover whether there was a false report, or we will rely on the disciplined forces to help us conduct in-depth investigation. The majority of cases, we believe their report and RAT is true. We have one case of suspected fraud, and it has been handed over to police for investigation. The second question was about death analysis. Currently, we have 6,000 plus deaths, and these deaths, we understand, in recent months, they also tested positive for COVID. Now, if we were to analyze each case, the reason for death, we need more clinical data, and we will have to collect more information from hospital authority looking into these cases and analyze how many of them were related to COVID. So we will draw reference from WHO and overseas institutions to conduct an analysis. Regarding social distancing and masks, the situation in Hong Kong is still in severe situation. So at this point, the public still needs to maintain social distancing. So when they're outdoors or in contact with other people, at any times, they should wear face masks to prevent infection. The last question was about medication. The oral medication, HA would like more suitable patients to be prescribed medication, and we will prescribe through different channels such as hospitals, designated clinics, our North Langtao Infection Center, the AWE Center, and even community isolation centers. In the private sector, we have set aside a quota for private hospitals, so they will follow our guidelines. Now, I mentioned yesterday that we do have public health procedures, so when the government requires cooperation with HA, we will do so.
Next question, the lady in the vest. Good afternoon, I'm from Cable News. Now, the chief executive mentioned this morning that an analysis would be conducted into death cases. Maybe some cases did not die of COVID. Now, in the future, when you announce death cases, would you distinguish patients that died of COVID and other illnesses? Would there be any challenges if you are to do that? And also, the hospital authority has tightened discharge criteria. Previously, some patients were allowed to discharge even when they tested positive. Now, they are only allowed to be discharged upon negative test on the 7th day. So was there a loophole? Now, there were some residents who returned to the care homes even though they were still positive. So would that cause a risk? Now, today there is a restriction testing declaration in the Quang Phuc estates in Tai Po. 4 out of the 8 buildings would be locked down. So is there a major outbreak in the estate? On analysis on death cases, we have to consider a number of factors besides vaccination record, other diseases, as well as medical record. We also have to consider other factors. We may need the participation of experts. So as we speak, analysis is being conducted, and we will update the public if we have any results. In terms of discharge, previously when patients were stable, they would be allowed to leave. For patients staying at home, if the home environment is suitable, they would be allowed to go home even when they were still positive. For care homes, we would work with the care homes to find out whether the environment is suitable for similar arrangements. Some care homes may have difficulties. So the arrangement was that patients could leave on a negative test result on the 7th day. And also with the shortage of beds, residents may be sent to the AWE Community Treatment Center or Elderly People's Holding Center or holding areas. So that's the arrangement in place. Now, since we want to rationalize and standardize the standard, we have updated the discharge criteria. Patients would only be allowed to go upon a negative test result on the 7th day. However, we would continue with the previous arrangement. About the Quang Phuc estates in Tai Po, the restriction and testing operation resulted from a highly contaminated sewage sample. So every day, the government would collect a sewage sample over the territory to search for the virus and identify buildings and estates with more cases. So the RTD operation in Tai Po Quang Phuc Estate is because of the high level of virus in the sewage sample. Next question, the lady over there. Hi, Now TV. Now a question on the RAT reporting platform. Yesterday, there was a case suspected to have deliberately reported a false result. So what's the detail of the case? 170 people were tested negative upon the confirmation test and were sent to Penny's Bay. So will they be tested every day? They are tested negative. So will they be allowed to leave Penny's Bay? And when was the random test carried out? So would it be a coincidence that they were tested negative, and would you test the antibody level? And about the discharge criteria for elderly people, yesterday you said you would consider the care homes environment in deciding discharge. So what's the standard? Have you found that most of the care homes are not suitable? That's why you updated the guidelines. According to the previous arrangements, some outbreaks might have been caused by positive residents being allowed to go home or go back to the care homes. So does the HA have to take responsibility for outbreaks in care homes? Now about Chinese medicine, you said some 5,800 patients have received Chinese medication. So what symptoms and why did these patients require a Chinese medication follow-up? The case has been passed on to the police for a criminal investigation, so I'm not in a position to divulge more details. Every day we would perform random testing on positive RAT results reported through the platform. Contractors would be deployed and deliver a swab to the patients, and then we would test the swab. Every day we discover a very small amount of swab samples that some tested negative. So usually we would select more recent cases for tests. On the subsequent day after the test, we would deliver the swab to the selected patients, and on the third day, the results would be available. With the PCR test results on the third day, we would arrange for those who tested negative on PCR to check into quarantine centers. And also some RAT positive patients might have check into isolation centers already. For those who have not, they would be arranged to go into Penny's Bay for a second PCR test. For those who tested negative on the second PCR test, or maybe it's a sampling problem, and for some, the second PCR test is generally negative. So we would investigate the cases and confirm that the first RAT was actually negative. For some patients, they might have got the results wrong. For a minority of the patients, they would be classified as false negative. So we would ask about the symptoms and why the patients performed the RAT. Were there family members with a contact history and so on? And then analysis would be performed. We have not found any other suspicious cases. About discharge of elderly patients, in the past, stable patients would be allowed to go. So the arrangements depends on the environments of the care homes. If the environment is suitable, we will allow the patients to return to the care homes. Well, this is not we adopt a flexible approach. When there is a shortage of beds, the patients would be arranged to go to isolation and quarantine facilities for continual care until they are tested negative. We will also deploy RH teams to support care homes. On Chinese medicine, I don't have the statistics. However, many recovered patients experience long-term symptoms, including coughing, chest tightness, and insomnia. So Chinese medicine can help.
Hi, good afternoon. English questions from the South China Morning Post. First, can you explain a little bit more about the TCM program for recovered patients? How many people? What is the capacity for people on this program? Like, how many people can this TCM service be used for? And earlier this morning, the chief executive announced that the anti-epidemic service pack to be distributed will contain 2 boxes of the TCM medicine for COVID, but it has been reported that not everybody is fit to take it, and it's not a preventative measure. So how medically advisable is it to be distributing these medicines at a whim like that? And can you elaborate a bit more about the progress of the COVID oral pills in terms of prescribing it in a private clinic setting? And another question is about so now on the on the RAT platform, 170 people were sent to Penny's Bay after they actually had a negative PCR. Can you explain the logic behind that? Because they're not really a public health threat if they have tested negative on a PCR. And how long will they be holed up in Penny's Bay?
Okay. I think I'll answer the first and the third question regarding the TCM and also the oral antiviral medications first. Okay, for the TCM, since the April of the 2020, we have provide service for more than 5,500 patients recover from COVID, and actually the total number of attendance is over 15,000. As for the oral antiviral treatments, hospital authority will facilitate as many as patients who are eligible to receive the medications, and through our different channels, including the CIF, CTF, and the designated clinic, and also as well as the patients staying in the hospital. But for the private doctors, because this involves some public health procedures, but we will liaise with the relevant government parties and also the Department of Health. And I think hospital authority will be very eager to facilitate.
For the RAT platform, the random sampling, every day after receiving the verified reports of confirmed cases or tested positive through the rapid antigen test, we will select a random sample and arrange another PCR test for them. The Department of Health will liaise with the contractor to send a swab collection back to the cases and request them to submit the swab to a nasal swab for testing in the Public Health Laboratory Services branch. Among the cases, a very small proportion of the sample, the patients, they have a negative PCR. Many we tested negative on the second day after they have received a positive RAT test. For these cases, we will carry out investigations, including collecting more information from them, including their symptoms, the reason for their RAT test, and also the contact history with other known cases, and the brand of the rapid antigen test used. And also, we will arrange them to be isolated in isolation facilities, mainly the Penny Space, and we will arrange a second PCR test for them. For some of these cases, their second PCR test were tested positive again, so they are true cases and they are confirmed cases, and they will be isolated according to the isolation order, that is 14 days since the first specimen, or 7 days if they have received 2 doses of vaccinations and tested negative by RAT on day 6 and day 7. For the other cases who were tested negative on the second PCR test, we will see whether there is any false submission of information to the Department of Health. And so far, we have identified 1 suspected cases of providing false information. For the remaining cases, if there is some of them are a very small proportion of them, we classify them as false positive, and we will terminate the isolation order. If both, if the second PCR test is tested negative, then if we consider them as false positive case, then they are not true cases, so we will terminate their isolation order and they can be resume normal life.
下一位嗰邊呢個行黑色衫嘅女士。
兩位醫生。
Ming Pao, I'd like to ask, you mentioned the positive RAT and subsequent negative PCR test. So how many people have been tested PCR negative? What is the ratio? And given your understanding of the RAT accuracy, is this level high or low? Why do we have these false positive cases? Do you see that the sampling might be done wrong, or where did the procedure go wrong? Are there certain brand names of testing products that are inaccurate? Can you provide some guidelines for the public? Second question regarding the quarantine notice. We have notices issued on 2nd of March, and yesterday was the deadline. So how many positive cases have you found, and what is the percentage? And third, I'd like to ask Dr. Au, you said you referred to elderly homes. So in the fifth wave, how many patients have been infected in elderly homes and homes for the physically disabled, and how many of them were vaccinated? You also referred to private clinics, private doctors prescribing oral medication. So how many private clinics said that they are willing to accept COVID patients? And is there anything they need to be aware of? Or can they also accept non-COVID patients? And just now Dr. Lee said that the death cases, especially in the younger people, how many people died with or died from COVID? And there was a 21-year-old male and a 55-year-old male. They were hospitalized, and were they infected in the hospital, or how did they get infected? Thank you. Regarding RAT testing platform sampling, we found that a small percentage, less than 2% of cases after the RAT positive, and in the second day when we conducted PCR, we had negative results. So for each of these cases, we will investigate and arrange for quarantine facility for further PCR testing. And we found a small percentage of second PCR testing negative, and that we might have a false positive cases, and that is to be expected. Typically, when we get a COVID positive test, we have to rely on PCR testing. PCR testing is very accurate and sensitive. It can detect COVID, but currently the pandemic is so severe in Hong Kong. The RAT is a reliable method to accurately predict, but the RAT is not as sensitive as PCR testing, and the accuracy would also suffer compared to our gold standard, that is, would pale in comparison to PCR. But typically, in general, the RAT, if a person is RAT positive, the majority of cases are true positive, but there is a possibility of a false positive. So when we sample the cases, we want to take some samples and see, when the public conduct RAT, how many PCR negatives do we get. We conduct investigations and we see if there's any false reporting. We investigate which brand or product they used, the sampling method, did they misuse the test kit. And we've had different cases when we looked at the photograph. The photograph did not look positive. They might have misread the information and made a false report. And some people might have taken the test earlier and they filled out the wrong date, and they might have recovered, and their PCR would be subsequently negative.
市民呢，因為
And there were also members of the public who did not report the results in time. So they changed the testing date to an earlier date because they want to report an earlier result. So that's why they have reported a false sampling date. Here I appeal to the public. You should not select an earlier date on our platform so that you can submit your results. If you miss the reporting date, which means that you didn't report your results in 1 or 2 days, you should send it to our email. We have an email address that is ratp.gov.hk. For whatever reason, we can register the previous results for you. Starting last week, we have been issuing CTNs on high-risk buildings. So the cases caught are all through PCR test. So members of the public will receive an SMS if you are tested positive, and if so, please submit your results as soon as possible through our online platform, and then we will issue isolation order and quarantine orders. Now, in the 5th wave, for care homes, for the elderly people, so far we have some 36,000 elderly care home residents who have tested positive, accounting for some 48% of the total number. For RCHDs, in the 5th wave, there are 9,300 residents in RCHDs tested positive, accounting for some 50% of the total number. On medication, I would invite Dr. Lee to take the question about private doctors and clinics. We would do our best to collaborate with them. However, public health procedures are involved. Concerning the 4 younger deceased patients, the 21-year-old male and the 55-year-old male, they were all infected in the care home, in the homes. I don't have much suspicion about the 4 cases. However, for the 58-year-old male, upon admission, he was unconscious and he required resuscitation, so we have to pass the case to the coroner. I don't have the information so far. However, I think that is very likely. Sorry, the speaker is not coming through the mic. So we are still investigating some cases. They might have entered the isolation facility in the past 2 days, and the second result is still unavailable. For the cases with 2 negative PCR test results, they only account for less than 1%. Hi, I'm from News. 2 questions. Now, medical manpower and isolation facilities capacities have risen. Why is the fatality rate remains high at 0.61%? For elderly people, what is the number of the side effects, cases with adverse effects after BioNTech? For elderly people, age 80 or above, are they eligible for BioNTech jabs? About number of deaths, like I said, after infection, when the situation deteriorates and eventually the patient passes away, we may be talking about 1 or 2 weeks time in between. So when we look at the daily death number, so compared with yesterday, we have an additional 192 new death cases. Most of the cases were not infected in 1 or 2 days ago. Most of them were infected, say, 2 weeks ago. The situation deteriorated and then eventually they passed away. So that's how we report or record the number. So there is still a backlog, and the number of deaths still remain at a high level. However, the overall number has climbed down compared with before. So the second question, does the government keep the record of elderly people at age 60 or 65 who experience adverse effects after receiving BioNTech jabs? For elderly people aged 80 or above, are they eligible for BioNTech jabs? So we have two kinds of vaccination, BioNTech and Sinovac. According to the data we have, both vaccines are effective in terms of preventing severe cases and deaths. So they have different side effects, and I don't have the record of the number of adverse cases after elderly people jabbed with BioNTech. TVB. There is a case from an elderly care home. After 4 days in hospital without a negative test, the elderly patient is being arranged to go back to care home. The care home would like the patients to be sent to the holding center. However, the HA said there is no such an arrangement. The care home has to contact the social welfare department to make its own arrangements. And the HA tells the care home that if they refuse to take back the patients, they would be blacklisted. So what is this blacklist, and what will be the consequence if you are put on the blacklist? So how come the HA can decide the blacklist for an institution under the social welfare department? Is there a referral or arrangement in place? And about oral medication, we have two kinds of oral medication. So what is the stock that we have? For oral medication, we cannot disclose the stock we have. At present, in total, we have prescribed more than 16,000 courses combining the two treatments. About the blacklist, we haven't heard of a blacklist. In terms of a discharge, discharging elderly patients, like I said, we would discuss with the care homes. If the environment allows and if the patient is stable, they would be discharged. That's in the past. For care homes with unsuitable environments, they would be sent to holding centers or isolation centers. So we had those facilities in place already previously. So now with the updated guidelines, we have a clearer approach. So for elderly patients, they would be discharged upon a negative result on the 7th day. And patients may also be sent to holding centers or isolation facilities run by the social welfare department and the HA. If there are no more questions, this is the end of the media briefing. Thank you.